UK agreed to be a science partner because the goals and objectives of healthcare partners align very closely to those of IMS Health of fueling the advancement of healthcare through improving patient outcomes by better access to innovative medicines.
I welcome any programmes that brings together informed opinion, expertise across the table in order to both discuss the issues but also to share information in order to promote best practice. And the more we can get this message out about the need to improve outcomes, the need to improve earlier diagnosis, for example, the better.
There's been a really interesting discussion today about how we can improve cancer services, and partly that's about individual experiences, but it's also about the collective expertise that there is represented in this meeting and in this ad board.
Today's meeting was very interesting to hear from a range of organisations. You've got clinicians, you've got the NHS, you've got health charities, and you've got industry who are talking about what they think needs to happen to improve outcomes for patients. So to hear that range of perspectives is really vital if we're actually going to make change that makes a difference to people's lives.
A lot of the time people work in silos and don't really fully appreciate what other people do, what part of the cancer agenda they are attending to. Coming together in partnership and putting the patient at the centre, the end result is better patient care.
We'll be working with healthcare partners to improve insights through our data services, but also through our market access and real-world evidence services.
If we had one key objective, it would be encouraging earlier diagnosis, which is why last month in December we were very pleased at our Britain Against Cancer conference. Simon Stevens, the NHS England Chief Executive, made it very clear that he was putting cancer one-year survival rates up and to the top tier of NHS accountability.
A forum like this gives us the opportunity to share that message and to engage all the people who are concerned about cancer in making a difference.
We want to make change for people affected by bowel cancer, but we know that we can't do that in isolation. To hear what's happening in other cancer types, to hear what's happening in other types of organisations, very valuable to us.
I see a programme like this supporting cancer patients on a daily basis in lots of different ways. If we decide that we're going to go along the theme of variation, hopefully better equity of service.
For me as a patient, I felt there were two very, very important themes coming out of today. The first was the importance of the quality of the patient experience, and not just the patient, but our families, the people we love, the people who care about us, the effects of the diagnosis, and of course the knock-on effects of what happens if things don't work out, or indeed if things do work out and you're lucky enough to survive for many years, as I've done. The second theme that's important to me is research, and I was very pleased to see how many people feel that research is very important, not just for improving the clinical outcomes for patients, but where research, information, taking more ownership of your own treatment decisions, all of that helps improve the quality of the experience we have while we're suffering with this illness.
It's really important that we work collaboratively to look at how can we improve services.
Already I've spoken to somebody who's very influential in NHS England. I now have her as a contact. I can contact her about specific issues. I can also contact her about innovation.
Sharing best practice examples of innovation is very important. To hear those different examples of innovation and what's working and what isn't working in different areas is fantastic.
This is absolutely a time when patient organisations, the industry and the NHS need to be working very collaboratively, and the whole point of healthcare partners is innovation through collaboration, which we're fully signed up to.